Please welcome our first guest, Dr. Tara Craig, who's with Novant Health Family and Internal Medicine in South Brunswick. Welcome to our show, Tara.
Thanks for having me.
It's great to meet you.
Good to meet you.
I know you've been with us a short time. So tell me a little bit about where you went to school and where you have recently worked.
Okay. Well, I grew up in Texas, born and raised my entire life.
Really?
And then I went to college in Charlottesville, Virginia at UVA. Went back to Texas for med school and then came back here to the beach for my residency, my medical training.
Where'd you do your residency?
It's with Tidelands. It's in Merle's Inlet.
Yes, I know where it is.
Residency program in Merle's Inlet. So not too far away.
So you're kind of a local person.
Kind of local, yeah. I mean, their areas are pretty similar for sure.
Yeah, well, that's a quick drive. I mean, you know, a lot of us go to, I have a place in North Myrtle Beach, so I'm down there a lot.
I know, and I had been commuting for a little while, so not too far away.
Yeah. So when you finished your residency, are you just recently out of residency?
Just recently out of residency, yes.
So what drew you to, I think I know the answer to this, what drew you to coastal North Carolina?
Well, the coast definitely grew on me during residency.
I bet.
And, you know, Texans never want to leave Texas, but I got married to someone who's from Charlotte, and he lives here locally. He works for Novant, so marriage drew me here to coastal North Carolina.
I kind of figured that, but I needed to ask it anyway. So it's really nice to learn about our new physicians and introduce them to the community at large. So this show does a great job of that. I wanted to ask you some general questions about women's health, including routine screenings, and there are a few. But I wanted to start with mammograms since the month of October is Breast Cancer Awareness Month, and it's right around the corner.
Yeah.
So talk to me a little bit about screening mammograms and how often and when do you start getting them?
Yeah, so I think you used a good word, routine. So for the average woman, it's actually, for us providers, there are 3 different guidelines, or actually more than 3 that you can follow. But to make it really simple for patients, somewhere between the age of 40 and 50, you know, gynecologists, family doctors, American Cancer Society can all agree between those ages is when you should start. But so 40, I would open up the conversation, but we can all agree that by 50 years old, you should have had a mammogram, your very first one. And typically that's every 1 to 2 years, depending on the provider.
Oh, you can go 2 years.
You can, and I would say it's pretty provider dependent and what specialty they fall under. And then also just depends on your whole history too. There are certain things that we might want to keep an eye on you closer or let you go a little bit further without screening. So.
Yeah, I assume there are some women who are at higher risk. What might some of those conditions be that would put you at a higher risk? Are they familial? If it's your mother, your sister, things like that?
Right. I think the biggest thing for patients to kind of, there's a lot you have to remember, but just any family history of breast cancer, I would bring it up and then kind of let your provider help you decide whether it's a distant relative or a mom or a sister, things like that. But any family history of breast cancer, if you had a male in the family that had breast cancer too.
Oh, wow.
And then ovarian cancer or other cancers, these are things you want your provider to know. But on that initial visit, we could do a good intake of your whole history. So it's good to bring things up, but these are also things we catch on our end too.
So someone with a higher risk might start their mammograms earlier.
Yes.
Is that correct?
Definitely.
Great. Well, that's really good information. What are some of the other screenings that women need to pay attention to?
Yeah, so Pap Smears is something that everyone's aware of, and that starts at age 21. All the way up until 65, and again, those ages, it just depends on your history. So if you're someone with an absolutely normal history your whole life, that's pretty much the age range. And you get them every 3 to 5 years, again, depending on your age. So these are things we help guide you, let you know how often you need to come back and get them. But,
so there's a lot of guidelines.
there are, and they vary. And so it's good to be checking in with your primary care provider annually so that we can help you meet all these guidelines.
How about colonoscopies? How often do they recommend those for women, and when do those begin?
That's a good one to bring up because recently we've changed this, and this one is across the board. Colonoscopies are now starting at 45 years old.
That's a change.
Previously it was 50, and this is for your average person without any big risk factors, which I can touch on. But colonoscopies now start at age 45. So if you have if you're at average risk or just routine screenings. Things that you might need a colonoscopy earlier for, and things you want to let your doctor know, is if you have a family history of colon cancer, if you have a history of Crohn's disease or inflammatory bowel disease, or any genetic inheritable things can make you need screening earlier.
Yeah. Well, let's switch gears to something that's pretty common around here, and that's high blood pressure.
Yes.
We live in the stroke belt. So why is it so common in this area, or why is high blood pressure so common these days? Is it our diet? Is it our...
It depends, but I think a lot of it does have to do with diet and exercise and the amount of salt we eat, things like that. And if high blood pressure is a problem, if it goes on for a long period of time, and it can lead to heart attack, stroke, kidney disease, even there are some studies that show cognitive impairment over time. And so again, just checking in with your doctor every year just to catch it early and to have us help promote healthy lifestyle tips for you to try to prevent yourself from falling into that category.
This is a great retirement area, and we have lots of seniors, and depending on what you term a senior, because nobody wants to say they're a senior. We all think we're still real young. I've noticed a great trend in switching from like tennis to pickleball. Do you find that in your practice? Have you heard about how common it is to play pickleball?
Yeah, I've heard that it's so common that sometimes people complain to their HOAs because it's so loud and keeping other people up at night. But
really?
Yeah. So,
oh my goodness.
I don't know if you ever heard the pickleball sound, but it's pretty loud.
Oh, does it?
Yeah.
I haven't heard that. No, I don't play pickleball, but I know a lot of people who do. And they're people that I found were not great about exercising, but they have found their niche in pickleball. So it must be, it must not be as strenuous as tennis. I don't know.
Yeah, it's less running around the court. The court's
It's
smaller.
smaller? Okay.
But I've seen people sweat, get their heart rate
yeah.
up playing. Yeah, so I think it's a great start if you're interested in trying to find some form of physical activity, for sure.
So before we close, is there anything else that you would like to add?
Yeah, just want to promote everyone eating healthy, exercising, picking up pickleball. If you smoke, quit smoking. Good sleep hygiene. All these things are also preventative medicine and can make your doctor's office visits very quick if we keep up with these things. So, yeah.
Well, my husband went to the doctor the other day and he had dropped 25 pounds, and the doctor said, "How did you do that?"
Yeah.
Because I tell people all the time they need to lose weight. You're the first ones walked in lately and you've lost 25 pounds. So
we can definitely learn from our patients. So
yeah. Well, thank you again for being here today. I look forward to having you back.
Thank you. Yeah, thanks so much for having me.
It's been my pleasure.